proceed with the topic gastroschisis versus omphalocele. This is one topic you need to know because there is one question coming every alternative year or so from this topic. So let's see what this is about. First, what is gastroschisis? What is omphalocele? So what is gastroschisis? Gastroschisis and omphalocele. Let's see how to differentiate between these two. Gastroschisis is nothing but during the embryonic stage, the baby has an abdominal wall defect, anterior abdominal wall defect, and from that defect, the intestines are coming out. So how will you remember? You remember this G for gap. So from this gap, the intestines are coming out. So anterior abdominal wall through which the intestines are coming. Not only intestines, it might contain colon, bladder, etc. But intestines are the most common one. So this is nothing but a defect in the anterior abdominal wall during the embryonic stage from which the intestines are coming out. But then what is omphalocele? Omphalocele is nothing but what? Normally during the growth of the baby, development of the baby, what happens is there is physiological herniation of the intestines occurring from the umbilical cord. So there is physiological herniation of the intestines coming from the umbilicus, which again return back to the intra-abdominal cavity. They usually return back by 11th week. Even if after the 11th week also the contents are not returning back into the abdomen, then this is called as omphalocele. So how do you remember this? Omphalocele, you remember this circle for like umbilicus. Umbilicus looks circular, no? So the circle for umbilicus, and from this umbilicus the contents are coming out. This is what they come. Usually they come out and they have to go back, but this is not failure to return of the contents through the umbilicus by the 11th week. So if by 11th week they're not returning, then it forms an omphalocele. As it is coming from this this sac like thing, the cover like. So you have a sac or the covering. It is a physiological thing, right? So you have this covering. And what is the sac made up of? It is coming, the organ is coming for suppose liver or the intestine is coming. It has this visceral peritoneum, right? So this visceral peritoneum is the inner layer and it is coming from the umbilicus. So you have an amniotic layer. So there is an outer amniotic layer and inner peritoneal layer. So the sac of the omphalocele is formed by what? Inner peritoneal layer and the outer amniotic layer. These two together form the sac of the omphalocele. So mainly you have to remember, he'll usually give this picture and ask which one is an omphalocele and which one is a gastroschisis. You should not confuse between these both. How do you remember? As we have seen, gastroschisis is nothing but what? Gap. From the gap or the defect, it is coming out. So this usually lies to one side and umbilicus is seen separately. This is not from the umbilicus, right? So there is a separate umbilicus. But in case of omphalocele, what is it? It is coming from the umbilicus, the circular thing. So there is a sac present. If you see this covering or the sac, then it is an omphalocele. If the sac is absent, there is no covering, the bowel is directly exposed to the environment, the intestines are exposed to the environment, then it is a gastroschisis. You have to differentiate it just by picture also. And as this omphalocele is having a sac, you can see the umbilicus present at the caudal end. In this, umbilicus is separately seen in gastroschisis, but in omphalocele, it is a single sac coming from the umbilicus only, no? So umbilical stump is seen at the caudal end of the sac. So that is one more difference. And in gastroschisis, we usually see intestines. Intestines are the most common content. In almost all 100% cases, you see intestines. But in case of omphalocele, this is a physiological herniation, right? So there can be liver, there can be intestines, anything can come out, bladder, etc. also can come out, but most commonly liver and intestines. And one more difference, as this is a physiological defect, physiologically occurring, but it is not returning back. So it is also associated with other congenital anomalies. It is also associated with other congenital anomalies. Most commonly, it is associated with Down syndrome. Omphalocele is associated with congenital defects and Down syndrome. So, whereas in gastroschisis, usually it is not associated with any congenital anomalies, but sometimes it might be associated with intestinal atresia. Intestinal atresia may be sometimes associated with gastroschisis. That is one more difference. And for gastroschisis, just remember this picture. If you remember one picture for gastroschisis, the other is obviously omphalocele, right? So this is the G we are talking about, and this is the gap and a separate umbilical cord. These are the pointers towards your gastroschisis. So what are the other differences? Let's see this table. Just remember it in the tabular form. Gastroschisis is nothing but gastroschisis location is where? It is a separate one, no? Defect. So it is usually towards the right side it is present usually. So it is towards the right side with a separate umbilical cord seen. Whereas in case of omphalocele, it is coming from the umbilicus. So it is in the center of the body. And one more thing, gastroschisis is not covered by membranes. Membranes are absent for gastroschisis. It's just a gap. And omphalocele is what? Membranes are present. Sac is present, comprising of outer amniotic layer and an inner peritoneal layer. And gastroschisis, no umbilical cord means that the umbilical cord is separate from this defect. This swelling is separate and the umbilical cord is separate. But in case of omphalocele, umbilical cord is inserted in the caudal area. Umbilical cord is seen along with the sac. So that is omphalocele. And gastroschisis is a embryopathy, whereas omphalocele is a fetopathy. What is the difference? We call it an embryo if the intrauterine life is less than 8 weeks of gestation. Up to 8 weeks of gestation we call it as an embryo, and after that we call it as fetus. So this, what did we speak of? At 11th week, if it fails to go inside, it is called an omphalocele. So this is occurring after 8 weeks. So this is a fetopathy, whereas gastroschisis is like from the embryonic life itself, there is a defect in the abdominal wall. So this is an embryopathy, whereas omphalocele is after 11 weeks, so fetopathy. And what are the contents? Gastroschisis, as we already spoke, usually intestines are seen in 100% cases. Sometimes colon, bladder also may be present. And in case of omphalocele, usually as it is a physiological herniation, we can have both intestines and liver also. Liver is such a huge organ and it also might come outside. So intestine and liver are usually seen. Spleen, colon, every other organ might be present in omphalocele. And what did we speak? Omphalocele is associated with congenital anomalies, whereas gastroschisis is usually not associated. But if associated, it might present with what? Intestinal atresia. So that is one point. And there is one more point. What is the most common tumor? What most common renal tumor in children? As we already discussed in the earlier sessions, this is nothing but our Wilms tumor. Wilms tumor or nephroblastoma. So in some cases, this nephroblastoma is associated with our omphalocele. So nephroblastoma and omphalocele are present together in some conditions, and that is called as our Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome. This is seen in some conditions. So this is our omphalocele and gastroschisis. Mainly you have to differentiate using this picture itself. So you kindly keep in mind this picture and keep on referring to this picture again and again once in a while so that you'll never forget this. Okay, done with the session. Thank you. Bye.